In this case scenario, Mr. Davis, a 62-year-old male, is admitted with heart failure, type 2 diabetes, and stage 3 chronic kidney disease. He presents with symptoms like dyspnea, orthopnea, and edema. His medical history includes atrial fibrillation and hypertension. Current medications include lisinopril, furosemide, digoxin, metformin, warfarin, and gabapentin. Lab results show low sodium and potassium with elevated creatinine and See this question. Which medication order places Mr. Davis at the highest risk for life-threatening complications with a potassium level of 3? The correct answer is digoxin, as hypokalemia increases the risk of digoxin toxicity, which can lead to severe cardiac complications. Which finding requires holding IV furosemide and notifying the provider? The correct answer is a potassium level of 3. Severe hypokalemia can increase the risk of arrhythmias, making it crucial to address this electrolyte imbalance before continuing diuretic therapy. What do you think the focus here? It is the patient education for long-term use of amiodarone. The most important teaching point is to report shortness of breath or cough, as pulmonary toxicity is a serious side effect of amiodarone. Early detection and management are vital to prevent complications. With an INR of 4.2 while on warfarin, the best action is to hold the dose and notify the provider. An INR 4.2 indicates a significant bleeding risk, necessitating careful monitoring and potential adjustment of anticoagulant therapy. What is lactic acidosis? This question addresses the risk of lactic acidosis with metformin use. The combination of metformin and chronic kidney disease, CKD, increases this risk, as metformin is contraindicated in patients with renal impairment due to the potential for lactic acidosis. Presence of yellow halos. Visual changes are a classic sign of digoxin toxicity, and recognizing these early can prevent further complications. Monitoring and adjusting digoxin levels are essential in managing this risk.
For gabapentin, the correct teaching is to be aware of drowsiness and avoid driving. Gabapentin can cause central nervous system depression, and patients should be advised to taper the medication rather than stopping suddenly to prevent withdrawal symptoms.
Before administering an IV digoxin loading dose, it is most appropriate to check the apical pulse for 1 minute. If the heart rate is less than 60 beats per minute, the dose should be held. This precaution helps prevent bradycardia, a potential side effect of digoxin. In the case of digoxin toxicity, indicated by confusion, nausea, vomiting, and bradycardia, the anticipated drug is Digibind. This medication is used to treat severe digoxin toxicity by binding to the drug and facilitating its removal from the body.
The most important intervention for safe management in this scenario is to monitor labs, renal function, and drug levels. This approach helps prevent toxicity from polypharmacy, ensuring that medications are used safely and effectively in patients with complex conditions.
In summary, this case scenario highlights integrated pharmacology, decision-making, focusing on medication safety, lab monitoring, adverse effects, and nursing interventions. These high-level questions reinforce readiness and clinical judgment for the board exam. It is essential for effective patient care.